This is basically diet principles for chronic kidney disease, liver cirrhosis or diseases, particularly dilated cardiomyopathy, that is a swelling of heart, and lung disorders where ascites is there. In this diet system, firstly, what not to be taken, which will act like a poison. If you say avoid, sometime patients will take such things which are harmful, stating that only the doctors have stated or dietitians have stated avoid only. So that is the reason why I am stating it will act like a poison, because this was experimented on my father when he was undergoing dialysis. The consumption of salt should be restricted 1 gram per meal, whether it is a breakfast or snacks or lunch or dinner. Why? Salt basically increases the retention of water in the body. And if you use 1 gram salt pocket, then you can enhance the more taste by knowing that I am taking 1 gram salt per meal only. Otherwise, you may take more or you may take less. Then when you take less, then you won't have a proper taste. So this is a first foremost important, the maintenance of the salt intake. Secondly, water should not be taken more than 1 liter. Thirdly, the most important, because everywhere people are having confused on this, the intake of cereals, that is a rice, wheat, jowar, these things, especially in chronic kidney patients, only wheat, rice and jowar has to be taken, which are having less potassium content. Other things like particularly millets like ragi, jowar, etc., and minor millets, foxtails, are very dangerous. So that should not be consumed. Even in diabetes patients also should not be consumed all those things. If they consume the rice and wheat, they will come out from the diabetes permanently like anything. And that too rice, after boiling the rice, that liquid has to be taken out. It should not be cooked in cooker. So once you take out that starch while preparing the rice, so automatically your intake level of carbohydrates will comes down. So your sugar level automatically become normal. And remaining 60 to 70%, you have to take this vegetable preparations or leafy vegetable preparations. Especially many dietitians, they say that leafy vegetables are harmful. It is not so. Only we have to leach and we have to drain out the water released from the leafy vegetables. Then, as I told you that coarse grains should not be consumed. It will act like a poison. And all dairy products except yogurt or else what you call curd, that can be taken, that too without cream and limited quantity. And baked food should not be taken like cookies, biscuits, which are having enormous preservatives, oils, fats, etc. Then in pulses, one should not take horse gram and red gram. And otherwise, the pulses also, other pulses should not be more than 5%. If you take more than 5% of pulses, again it will become like a poison because it's having indigestible protein, affects the kidney. Then in non-vegetarian, one should not consume beef, pork, mutton and chicken with skin. And in normal food, you can go 5% of de-skinned chicken and 15 to 20% you can go for fish, that too baked one with defined herbs. One should not take alcohol, aerated beverages, fruit juices. But whereas banana stem juice is very important, that has to be taken. In fruits, any fruits can be consumed except banana fruit. That too, other fruits also in a limited quantity by observing your potassium level. So, like this, you should again and again go through this video, what not to take. So, those things you strictly adhere it and follow it. So, definitely you will see the sea changes in your body. Thank you.